The operating room is a sanctuary. It is a place of meticulous precision where skilled hands hold the power of life and death. Patients place their trust in surgeons, believing in their oath to do no harm. But what happens when this sacred trust is shattered? What happens when a surgeon, driven by arrogance and delusion, inflicts pain and suffering instead of healing? This is the chilling story of Dr. Christopher Duntsch, a Texas neurosurgeon who became known as Dr. Death. Christopher Duntsch seemed to have it all: a prestigious medical degree, a promising career, and a charming demeanor. He joined Baylor Plano Hospital in 2011, eager to make his mark on the world of neurosurgery. But beneath the surface of this seemingly accomplished surgeon lurked a dark secret, a trail of negligence, incompetence, and utter disregard for human life. Duntsch's surgical skills were not merely inadequate, they were abysmal. His procedures left patients with permanent disabilities, excruciating pain, and, in some cases, death. As his surgical disasters mounted, a chilling pattern emerged, one that would send shockwaves through the medical community and beyond. Duntsch's story is a stark reminder of the immense responsibility that comes with the surgical profession. It is a story of hubris, negligence, and the systemic failures that allowed a dangerous individual to continue operating on unsuspecting patients. It is a story that demands to be told, not only to expose the horrors that unfolded, but also to prevent such tragedies from happening again. Even before Duntsch stepped into an operating room in Texas, there were red flags. His residency at the University of Tennessee Health Science Center in Memphis was marked by concerns about his behavior and surgical abilities. Some colleagues noticed a disturbing lack of conscientiousness and a tendency to cut corners. Whispers of his erratic behavior and questionable surgical decisions followed him. One incident in particular should have raised serious alarms. During his residency, Duntsch was found intoxicated and disoriented while on call. This incident, a clear violation of professional standards, resulted in him being placed on probation. It was a glaring warning sign, a glimpse into the recklessness that would later define his career. Despite these early warning signs, Duntsch managed to complete his residency and obtain his medical license. How did a surgeon with such a troubled past slip through the cracks? The answer, in part, lies in the fragmented nature of the medical system and the reluctance of institutions to take decisive action against one of their own. Hospitals and medical boards often prioritize protecting their reputations over ensuring patient safety. This culture of silence allows dangerous doctors to move from state to state, leaving a trail of devastation in their wake. The human cost of Duntsch's actions is immeasurable. Behind the sterile statistics of medical malpractice lawsuits lie real people whose lives were irrevocably altered by his negligence. Their stories are heart-wrenching testaments to the devastating consequences of medical incompetence. One of Duntsch's patients, Kelly Martin, went in for a relatively routine spinal surgery. She never walked again. Duntsch's botched procedure left her with permanent nerve damage and chronic pain. Another patient, Jerry Summers, was a childhood friend who trusted Duntsch to perform a simple neck surgery. Instead, Duntsch severed a critical artery, causing massive blood loss that left Summers with a debilitating stroke. These are just two examples among dozens. Duntsch's patients, many of whom were already suffering from debilitating conditions, went in hoping for relief. Instead, they were subjected to unimaginable pain, life-altering injuries, and, in some cases, death. Their stories serve as a chilling reminder of the profound impact a single individual's actions can have on the lives of many. Section 4. A system failure. The ignored warnings and missed opportunities. As Duntsch's surgical disasters mounted, a chorus of concern began to rise from within the medical community. Fellow surgeons, nurses, and operating room staff witnessed firsthand his recklessness and incompetence. They reported their concerns to hospital administrators, urging them to take action. But their pleas for intervention were met with indifference, inaction, and, in some cases, hostility. One nurse, Michelle Schugert, was so disturbed by what she witnessed during one of Duntsch's surgeries that she documented his every move in a detailed email to her supervisors. She described the surgery as a massacre and pleaded with them to stop him from harming another patient. Despite her harrowing account, Duntsch was allowed to continue operating. The failure to stop Duntsch was not due to a lack of evidence. It was a failure of the system itself. Hospitals, often more concerned with protecting their reputations and avoiding lawsuits, were hesitant to take action against a surgeon who brought in significant revenue. The medical boards, tasked with overseeing physician conduct, were slow to respond to complaints and often lacked the authority to take swift action. This lethal combination of institutional inertia and regulatory loopholes allowed Duntsch to continue operating long after it became clear he posed a grave danger to patients. Section 5. The Walls Close In, the Investigation and Duntsch's Arrest. The tide began to turn when two spine surgeons, Dr. Robert Henderson and Dr. Randall Kirby, took it upon themselves to stop Duntsch. Appalled by the carnage they witnessed firsthand while trying to repair his surgical disasters, they became relentless advocates for his patients. They collected evidence, filed complaints with the medical board, and contacted law enforcement, determined to bring Duntsch to justice. Their efforts finally caught the attention of Dallas County prosecutor Michelle Schugert. Recognizing the criminal nature of Duntsch's actions, Schugert assembled a team of investigators and medical experts. They meticulously reviewed medical records, interviewed witnesses, and built a case that would expose the full extent of Duntsch's crimes. In July 2015, more than 2 years after the first complaints against him surfaced, Duntsch was arrested and charged with 5 counts of aggravated assault and 1 count of injury to an elderly person. The arrest sent shockwaves through the medical community and beyond, as the world learned of the surgeon who had been allowed to operate with impunity for far too long.